Okay, good afternoon and welcome to our class in the morning session. So it's now 12 noon. I'm sorry because I'm on a meeting, so I have to move our schedule at 12 noon. So hopefully any one of you can come in. So to start with, we are now on the last topic of our module, the last module, which is important infectious diseases of poultry. And I'm going to show you also video on the last part. After that, about organic chicken. No? Kasi we've been talking a lot of conventional and commercial chicken broiler and layer raising. So also although it's free range, but in the free range, it's just they are not inside in the cage or poultry house. They are arranged everywhere, but then you can still do a conventional or commercialized one. But in for organic chickens, it completely organic. So let's watch this later. And so these are the important infectious diseases of poultry. And when we say disease, it's a condition caused by living factors like viruses, bacteria, parasites, or even non-living factors such as deficiencies, toxins, and other physical or chemical agents. And they are being classified based on the causative factors, not like for bacterial diseases. Hi, John Ray. So, sorry Hana na 12 noon. So, supposedly lunchtime kayo. So, but I will be brief, no, as for hopefully for 30 minutes or less than 40 minutes. So, again, we are now on diseases of poultry. So, these are caused by, as I have said, virus, parasites. And this is the main talaga challenges when you do the poultry and even any livestock production. This will cause severe loss in production from death of the birds and also uh, loss in the production as a whole. So these are the common diseases. So we classify them as bacterial diseases now since they are caused by bacteria. So we have first the coli bacilliosis. It's a common bacterial disease caused by Escherichia coli. So it's very common even in humans. It's also very infectious, no? So sa atin, pagka may E. coli tayo, syempre magkalibanga ta, no? And so on, kalintura hanggang sa poison, magkaka-poison. So, in poultry naman, so these are the following symptoms, no? Mahirap kasi sa mga animals because they cannot talk, no? So, we have to really observe their signs. So it can be manifested through such different forms such as infection ng yolk sac, no, or cholesepticemia, or and others, and also lethargy and diarrhea. So pag mahirap din, no, how would we know na mag-diarrhea yung mga chicken? Can you say John Ray, based on your experience, mahibalaan nimo unsa nimo pagkabalo nga may naay diarrhea ang imuhang manok?
Yeah, ma'am.
Unsa nimo pagkabalo or sa imong experience nakabalo ka nga kakita na kang manok mo gi-diarrhea?
Wala ma'am.
Listen kay no, mag-iti-iti ra man na sila. So malay ba na.
Yes po, ma'am.
But then if you are a veterinarian, so it's a major challenge for them. So maybe it has really difference like ganong how to do if have you seen the photo kung ang chicks ba lalaki or babae kasi inigdag ko na sila dali raman mahibalaan, 'di ba? Pero kung chicks pa sila kato vent sexing or feather sexing, mahirap siya, 'di ba, John Ray?
Yes po, please should good. Pero there are some gano'n na ang mga expertise para ana ma'am no?
Yes. So,
Can easily identified.
yes. Kung sanay ka na pod, if you are into this business, so masasanay ka pod. Okay, so
So, ma'am.
you just control infection, especially sa UCSA, on using sanitary conditions sa hatchery, and also warming during brooding, so it can help them against kulay, and the practice of efficient na water sanitation, like use ng clean drinkers and provide ventilation, no. Next is the salmonellosis, no, and it's caused by Salmonella gallinarum. So we also have bacteria Salmonella that causes um, infection in humans. And of course, these are transmitted from the parent flocks, and which affect the baby chicks, and they could die, no, high mortality. So ano yung mga symptoms? We have huddling, pasting of feathers, and whitish diarrhea are noticed. So ang ilahang itim mag whitish, no. And ensure salmonella-free chicks from the hatchery using sterilized fish meal, and yung mga pagkain nila meat meal should be sterilized. Or pelleting of the feed will also be helpful, and you can add furazolidone to the feed para ma-control ang salmonella. It's one also very common. Next, we have infectious coryza. It's also a bacterial disease caused by Haemophilus paragallinarum. And pag swollen yung faces nila, yung eyes filled with cheesy substance, and they have respiratory distress, poor feed intake. So, manotice. Yung alam ko lang talaga, pag ang animals is merong sakit, whether disease siya, bacteria, virus, and so on, is dili sila mahilig kumain, no? Dili na sila mukaon. So,
Yes
avoid,
po, ma'am.
'di ba? Mo lang ginaang noticeable. And avoid overcrowding and wet litter para ma-reduce nimo ang infection, and also ammonia level by ventilation. So, we have fowl cholera or avian cholera, avian pasteurellosis, and avian hemorrhagic septicemia. Is also a contagious bacterial diseases caused by Pasteurella multocida. And the combs and wattles ng poultry become swollen and bluish, and with high mortality and morbidity, with meron siyang watery, basta cholera, nasal discharge, and saliva dripping. So, medyo observable ito. And pinpoint blood spots on the heart and duodenum. So, pag na ano na siya naihaw, makikita mo yan. And white spots on the liver are present. And also diarrhea. So you control the rodents, and proper management that would help the cholera, and ventilation and stress-free conditions. So yung mga old or parental stock like cock are more susceptible in this case. And the last one, bacterial disease, is the chronic respiratory caused by mycoplasma. So, mahirap sila manghinga, no? Respiratory distress, merong sounds of rales, sneezing, poor weight gain, and nasal discharge. And they are transmitted through feed and water. So, i-avoid yung overcrowding, improve ventilation, and ensure hatchery sanitation and screening of parent stock. So, you mix thiamutin or tylosin in the feed as a control. So for viral diseases, John Ray, sabaan ra ba ka? Ako ang mga sakop diri saba kayo. Bingkay!
Okay lang naman po, ma'am.
Sabaan kayo sila. Kadali lang ha. Klase ko ba? So, that's it, no? for viral diseases, these are prevented by carrying out vaccinations at recommended age. So, if you remember dati, merong mga schedules na for vaccination. So, these are for viral diseases. So, naniota na ka dyan, Ray?
Wala pa po ma'am, pero nag-snack na po ako ma'am.
Sorry, pero pwede na ka magkaon-kaon dara ha. At least ikaw, mamina raman ka. And you can just have, work lunch. So, ang una is we have Newcastle disease. I know you have heard this many times. So, it's very contagious and lethal. And it's also known as viscerotropic, or it will attack the internal organs, and also vilogenic Newcastle disease, or VVND, or exotic Newcastle disease, or Asiatic Newcastle disease. So, for the transmission, it's very contagious. So by short distance, it's airborne. And also can be passed in the egg, or infected embryos die before hatching. So sa live birds naman, the virus is shed in body fluid secretion, excreta, and breath. So yung mga signs na ay mildly pathogenic, could be also moderate pathogenic or mesogenic, lentogenic, and highly pathogenic or velogenic yung mga tawag. So, yung mga symptoms niya ay watery discharge from nostrils or labored breathing, gasping, and facial swelling. And also paralysis, trembling, twisting of the neck, grabe no, twisting of the neck. That's the sign of central nervous system involvement na. So there are 10 to 80% mortality range depending on the pathogenicity. And in adult laying birds, symptoms can also include decrease ng feed, water consumption, and dramatic drop in egg production. So how do you control this? There's no specific treatment since it's virus. But antibiotics can be given for 3 to 5 days para ma-prevent yung secondary bacterial infections, especially yung E. coli. So for chicks, increasing brooding temperature also up to of 5 degrees Fahrenheit may also reduce. So another one is the infection bursal disease, or IBD, or Gumboro disease. So I've also heard this before, or maybe new to you. So this is caused by Berna virus of serotype 1, and is very stable and difficult to eradicate from the infected farm once infected siya. Pareho din itong mga virus, pareho din sila lahat. Most specifically sa yung naranasan natin ng pandemic ngayon na COVID virus. So yung transmission niya is very infectious and spreads easily from bird to bird by way of droppings naman, not airborne. So yung signs is between 3 and 8 weeks of age, depending sa maternal antibody levels. This will affect birds with restless, depressed, pale, huddling, and producing watery white diarrhea. So yung mga cases have a mortality rate of 5 to 10 or even 60%. And highly pathogenic strains, no? So mayroon ding ibang strains. Can be very virulent. It means very infectious siya, and resulting in high mortality. So magkakaroon ng post-mortem lesion or acute cases ng bursa is Fabry, oh my God, enlarged na fabriculosis and gelatinous, sometimes even bloody. At saka yung muscle hemorrhages and pale kidneys can be seen. And also lack of white blood cells or lymphocytes will reduce in reduction in development of immunity and decrease resistance of birds to other infections. So the next one is the Marek's disease caused by a herpes virus. So we also have a herpes virus, yung mga sexually transmitted disease natin, no? In humans. Okay lang. So it spreads from bird to bird contact pa din, and with infected dust and dander, and by darkening beetles and mealworms that live in the chicken house. And morbidity is 10 to 50% and mortality up 100%. Ganun ka ng mortality, ano siya, contagious. And it can affect flock, typically continues at a moderate high rate of in just few weeks. So there are different forms of the Marek's disease. We have the cutaneous form or nasa skin lang siya. So enlarged red and feather follicles and white bands on the skins na merong brown crusty scabs. So pag scabs yung mga uh, kanang sa pagana spots. And neural nerve form or progressive leg or wing paralysis. So twisted neck, weight loss, labor birthing, eye lesions, and so on. No, madami siyang symptoms. So pag visceral naman siya or internal form, tumors or visceral organs such as the heart, ovary, test and muscles, lungs. So typically, birds now have depression before death and transient paralysis syndrome is associated. And usually, yung death is caused by paralysis. As you can observe them, di na kayo sila makalakaw, tarong kalupad. So, and we also have the avian influenza. It's also caused by virus. And also in the pet, zoo, and wild birds. So they are typically of low pathogenicity compared to the rest, but causing subclinical infections, respiratory disease, or drops in egg production. And this also cause severe systemic infection with high mortality. So pag highly pathogenic siya, it's called foul plague, no? Foul plague. So uh, I have heard this many times, no? And in most wild birds, these are subclinical except for the recent na H5N1. Sinapit sila yung mga inana, virus of the Eurasian lineage. So actually, this virus says the avian flu is influenza pala is our type A orthomyxoviruses characterized by antigenically homologous nucleoprotein matrix internal proteins. Hi, Jacqueline. Naniyon to naka, Jack?
Yes, ma'am. Wala naman.
Very good. So, sorry naman ko meeting. So, I have no other choice then since 11 to 1:30 man na to ang ano, schedule. So we were talking about diseases na, and then we are almost done with we're done with bacterial diseases, and we're almost done with viral diseases. So most of these AI viruses are further divided pa into 16 hemagglutinin, so on, mga ganon. And there's itong H116 subtypes ay medyo low pathogenic siya. But yung mga H5, H7 AI are highly pathogenic for chicken, turkeys, and related na gallinaceous domestic poultry. So in terms of transmission, usually yung through migration, no? And yung mga occasionally, pag nag-import ka ng beds, and that's why meron tayong biosecurity. Dili lang ka basta-basta nga magdalag pet or birds or anywhere from one country to another, but within the country, dili kita strict. No? So, and that is one of the causes of transmission and epidemiology. No? But now we are very much aware because of the virus. Now we have this the coronavirus. No, we have this situation now. So it's also happening for poultry. So in fact, yung transmission nila is also migration. Yung sila mismo, alam niyo naman kung anong migration, no? Yung mga group of birds na nag-migrate from one place to another. And also importing or transfer, no? So, incubation is highly variable. So depending from few days to 2 weeks. So ganun talaga commonly ang mga virus. And is the transmission can be ingestion or inhalation depending kung um, airborne siya or through droplets, no? And cats and dogs also can be infected with one strain, no? Pwede rin from one species to another. And but not so much from person to animals, no? Hindi masyadong ganon. And if there are, although there are been happening na merong transmission from animals to humans, but they are really very rare. Kagaya ng AIDS, no? AIDS came from a monkey. Alam niyo yon?
AIDS po ma'am, galing sa monkey.
Ito yan sa AIDS na virus. Ito yan ng AIDS. I forgot. So, kadalahan ng mga viral, mga ano. So, it also come from a monkey, no, originated in somewhere in Africa, and then, ayun, and it's now one of the sexually transmitted diseases around the globe. Even here in our places, in our region, ang pinaka madami daw is mostly mga mga transgender, I'm sorry to tell that, ha. But yeah, just to be aware of, no, more on, kasi one time nagpa-AIDS, nagpa-AIDS, certificate test. It's a requirement for you before I went abroad for overseas work, no? So, ayun na nga. So, I have that experience. And madami pala talaga nagpapatest, especially yung mga, yung alam mo na yung negosyo nila ay ganon. So, going back to our topic, so even the domestic pests, no, also could serve as transmission vector in the farms or in other where sometimes could be unknown. And also experimental infections can occur, between chickens or contact exposure, cats and dogs na susceptible. And also other mammals na infect na for experimental, include pigs, ferrets, rats, and so on. Mga non-human primates din, like the monkeys. And also between farms or breaches of biosecurity practices pag hindi natin like na mga smuggle, na mga rabbits or any animals na nakapasok ng country without biosecurity. So, yung transmission is also could be through contaminated feces and respiratory secretion, through the equipment or clothing, or airborne dissemination between farms. So, however, there are also limited spread by wild birds of duration ng mga types of virus, not typically, and HPAI virus. So, meron din silang minimal potential to infect dogs and cats. So, yun. So, clinical signs, severity ng diseases, and mortality rates will depend on which strain and which dose. So, meron ditong level na low pathogenicity and high pathogenicity. So, pag low pathogenicity, hindi siya masyado highly mortality rate. So, usually na respiratory signs are sneezing, coughing, ocular nasal discharge, swollen intraorbital sinuses, and sinusitis is common in maraganig ko nakakita na mo ka ng manok nga maraganig nag-aaching or any bird, so mga ganon. So pag high pathogenic siya, They can cause severe systemic disease with high mortality. So chicken, turkeys, and other gallinaceous poultry with as high as 100% in just few days. No? Yung mga common symptoms. So, and also diagnosis. So, kailangan mo i-diagnose yan. It means that you get the sample and then you're going to isolate, verify na yan yung talaga. Sa dami kasi ng strain ng virus, so kailangan malaman mo na yun yung virus specific na nakakos. So, ayan. And usually, yung mga signs yan, i-verify mo. So, for the prevention naman and treatment, so, vaccines lang talaga. And, you have an idea already because of this pandemic, how long or probable it is to develop a vaccine. For animals, medyo hindi masyadong risky kasi we can afford a lot of, especially for poultry or for birds. No? And we also have the so-called zoonotic risk. No? It's viruses exhibit host adaptation to birds. So some become adapted already, no? And human infections have occurred already and usually has as isolated, rare, or individual case. So most human cases have originated from infection with the Euro-Asian H5N1 virus. And sabi nila yung corona ay galing sa bats, diba? And most recently, yung Chinese na H7N9 LPAI virus. So, magka-family lang ito sa coronavirus. So this is just the history of the avian influenza virus. So for so much more on viruses, so we also have fungal diseases. We have first brooder pneumonia. So this attacks young chicks of 1 to 2 weeks of age with a mortality of 10 to 50%. Symptoms is gasping, respiratory distress, and strong thirst. Yellowish white pinpoint filaments of lungs are also present. Ang nakaano sa mga fungal diseases is meron talagang symptoms ng mga molds, fungus, infested litter material. So, you should always clean drinkers and feeders. And fungal diseases, marami namang mga fungicides na pwede natin gamitin to disinfect the area. And we also have the second one, the mycotoxicosis caused by mycotoxins. So, normally common ito kung sa copra, di ba kita namog ka ng mga toxins or fungal sa copra. And also feed ingredients, no? So, ang ano nito is, ang symptoms is reduced food intake, poor growth rate or egg production, and breakdown of immunity and vaccination failures. So you should avoid moderate feed ingredients or use toxin binders like zoylites, aluminum silicate, or charcoal sa feed, and then add liver tonics and withdraw fungal infested feed. So kahit kamo nagakaon mo ka ng maningon na kanang pag makakaon mo maninga ka na ganing medyo pait sa kayo, makakaon na mo ana, Jacqueline?
Wala pa po, ma'am. Hindi po, ma'am.
Wala pa, ma'am.
Ako kahit kanang sa una, no? Kanang makakaon ko pa kay nga mani, and that is aflatoxin already. So, kanang sa una maka-remember ko, sayangan ko, ako na lang siyang tulon, but that it's not really good, ha? Kay that's infected with aflatoxin, and that is fatal. Mycotoxin comes with your liver, and liver ba ay lungs pala, so makaka-cancer siya, makakapatay. So, general disease control measures, you buy chicks from reputed disease companies. Ayun. And adhere strictly, no vaccination. Adhere strictly, no naman. 2 vaccination programs. So, kailangan dili na pwede nga halimbawa na pultayhan o ultrihan ka niya, walay vaccination. But let's watch the last, although we still have quail production, no, but the last for chicken production, yung organic chicken production. Tingnan natin how do they get rid of vaccination. And you keep the houses clean, and sanitation, litter, feeder, and water. So nakita ninyo in the previous videos paano sila grabe talaga kalinis, no? Ganun mag-sanitize. Then follow medication schedules, then disposal through burial or incineration ng waste and dead, especially kung infected ng virus. Earmark areas for specific age group and screening visitors. Kailangan foot baths. May mga foot bath na ilalagay sa bawat entry with sanitizers or sanitizer. And all-in, all-out system is very helpful para isahan lang yung paglilinis and personal sanitation. Maski ang nagbabantay should be sanitized. So vaccination, prevention is better than cure that's why mas safe pag naka-vaccinated. And many viral diseases cannot be treated but can be controlled only by preventive vaccination. So this will, for the routes ng administration, pwedeng drinking water, no? It's a labor-saving method, or reconstituted in the cold drinking water with skim milk powder at a rate of 4 grams per liter water. And, it's for the RDV Lasota vaccine. Or pwede ning intraocular intranasal installation. It's usually in normal saline solution or salt solution using 1 drop of diluted vaccine to the nostrils or eyes, like the RDVF. And then these are absorbed in the mucous membrane and immunization is okay. So pwede ring spray vaccine by spraying or mis-spraying the chick boxes in the hatcheries. Or small drops of the equal size for 10 to 15 minutes, then drying through light or hot air. And or wing web puncture method. So maraming methods using the fowl pox vaccine with 50% glycerol saline. So they are taken in pork needle and vaccination is done by puncturing the wing web. Although you should be careful, no, not to damage the muscle, nerve, and blood vessels. We also have the feather follicle method. So sa pigeon pox vaccine with 50% glycerin saline, so after flocking ng feather follicles in the internal high region, so ang glass rod is smeared and rubbed. Then after 5 endeavors had to be examined for similar reaction taking place in the nervous system. Or subcutaneous injection using the Reniket K vaccine with normal saline and 0.5 ml is given between 2 layers of skin and the wing-web region without damaging nerves, blood vessels, and muscles. So, kaya nga, favorite kay nako ang wings, chicken wings ka mo. So, sa chicken wings kasi, nandyan lahat ng mga injection kanina, no? So, in subcutaneous...
Bantog dahil lami, ma'am.
kata ng vaccine na, dara, no? But hopefully, all the vaccines are dead when after being cooked, no? So you protect them in ice bath during vaccination within 1 hour. So pwede naman debaking, no? Debake the layer birds to control feather pecking and cannibalism and bullying. So debaking is another procedure. This is not part now of the routes or vaccination administration. So this is just for to prevent cannibalism or tawag sa kanila bullying. May bullying din ang mga mga birds or poultry. And it's done by electrocautery, no? Or remove one-third of the upper beak, taking care to avoiding punk. And this is practiced at the age of 10 to 14 days and repeated again at 14 to 16 weeks, uh, but never do it with a pen knife. So overcrowding, inadequate space, feeding, watering, and resting, starvation, and so on may predispose the birds to cannibalism. So, pag overcrowding na siya and less ang pagkain ng nutrients, so may tendency silang mag-cannibalism. Kainin nila yung kanilang sariling mga kasama. So, so ibibig sila. So, ito yung procedure, no? You hold the wings by left hand and the tongue is pushed backwards para hindi masali, and you open the mouth and introducing index finger to the tongue but not to cut it, but the upper beak is cut in to one-third of its length lang, and lower beak is slightly trimmed. Then after debeaking, bigyan ng vitamins and antibiotics for 3 to 5 days to avoid stress and secondary infection. So aside from debeaking, meron din tayong deworming to them, or the process of removing worms from digestive tract ng birds. Usually tapeworm. They are consumed from earthworm, cockroach, no, yun. And eventually consumed by hosts, and we don't want it not to eat. Pag, although, namamatay naman lahat pagluto. Pagluto natin. That's why it's really very important to cook our food. And the eggs or oval roundworms are passed into droppings which is picked by other birds also directly or indirectly. So with the help of chance carriers like personnel, insect lice, ants, and other, so this can also disseminate. So sometimes wild birds such as crows may also source of infestation. So if infested, the following symptoms are dullness, weakness, emaciation, paralysis also due to the toxin produced from worms, enteritis or diarrhea with blood, and anemia due to sucking blood by worms, and drop in egg production. Ito yung mga, one of the yung mga common symptoms, no? Drop in egg production. So pag larger na yung infestation, so mechanically block of intestinal lumen, and sometimes rupture occurs and results in intestinal stasis of food particles. So deworming should be practiced at every 45 days in layer birds and also before the RDBK and vaccination. And this is done against tapeworms. So another one is releasing, no? The process of removing external parasite like ticks, mga kuto, mites, and fleas that suck blood from the bird. So usually itching, restlessness, external wounds, loss of body weight, weakness, anemia, and drop in production. So how do you control it? With the use of chemicals to remove the external parasites. During sunny days, we use somathion or malathion. This is an insecticide, 5 ml in every 100 ml of water. So, i-immerse mo lang yung bird doon sa chemical solution, avoiding eye and mouth. Kasi, kodono. So, mapuling sila, and it's the deep one has to be dry, separate enclosure, and the feeders or waterers in the building should be sprayed with all the insecticide to remove the external parasites. And after dripping of the birds, para ma-relieve yung stress nila, you give them vitamin A, B complex, and para ma-improve din yung health ng birds. So that's all for the pests and diseases. So do you have any questions or clarifications? So we are just so let's just watch this, and then we'll proceed next meeting with quail farming, and the rest of the meetings will just be review, no, of our exams. Okay, so that's it, no? So it's you have now tips on how to do the organic chicken production without the vaccination. So anyway, organic kasi they make use of they don't use chemicals to treat diseases and also for their feeds, but they use yung mga probiotics nakita nyo kanina at saka yung mga herbal medicines for control ng mga colds using yung mga herbs, no? Yung mga natural herbs natin. So, do you have any questions or clarifications? Jacqueline and John Ray. Si John Ray gutom na. So, I know mahina ang signal ninyo.